Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. What if ticks, fleas, and biting flies could transmit an infection that's hard to detect? It's not hypothetical, it's Bartonella. This is the People's Pharmacy with Terry and Joe Graydon.
Bartonella is mostly known, if at all, as the germ that causes cat scratch fever, but there's growing evidence that it's also transmitted by fleas, lice, ticks, and even biting flies.
The infection can cause symptoms as varied as nerve pain and joint inflammation, or balance disorders and brain fog. Why is it so hard to diagnose? Is there any treatment for this chronic condition?
Coming up on the People's Pharmacy, we'll learn more about this mystery epidemic.
First, this news.
In the People's Pharmacy health headlines, episodes of low blood sugar may put an older person at risk for dementia. Researchers followed nearly 800 patients with diabetes. They were at least 70 years old at the start of the study, which lasted for 12 years. Those who needed to be treated for hypoglycemia had double the risk of developing dementia during that time. Hypoglycemia is severe low blood sugar and often results from aggressive treatment for diabetes. If too many medications are taken or the dose of diabetes drugs is not adjusted properly, hypoglycemia can be a common complication of treatment. Guidelines have often encouraged physicians to lower blood sugar into a normal range, but such recommendations may result in more hypoglycemic bouts. The brain relies on glucose as its energy source. When blood sugar falls too low, it leads to cognitive impairment. This is a vicious cycle, since people with dementia have a much harder time managing their diabetes appropriately. The take-home message of this new research is that aggressive diabetes management that leads to hypoglycemic episodes may do more harm than good.
Aggressive blood pressure treatment may also pose a risk for the brain. Dutch research published in JAMA Neurology shows that people who have low diastolic blood pressure are more likely to have brain atrophy. More than 600 patients with vascular disease were followed for almost 4 years. MRI images were taken of their brains at the beginning and again at the end of the trial. Blood pressure was also carefully monitored. 2/3 of the subjects in the trial were taking blood pressure medication. Those with diastolic blood pressure of 70 or less had greater brain shrinkage. This complication was accentuated in those patients whose blood pressure dropped during the study. The authors conclude that lowering blood pressure in patients with low diastolic readings might be harmful to the brain.
Heading a soccer ball repeatedly may also result in brain injury. Researchers detected microscopic changes in brain structure among players who headed the ball more than 1,000 times a year. Memory scores were also lower in those who headed the ball 1,800 times or more annually. During practice, players may head a ball 30 times or more in quick succession. During a game, a soccer ball may be moving at 50 miles an hour. Some players may head the ball a dozen times or more. The investigators call for research to develop strategies to protect the brain during soccer practice and games.
Most medications need to be stored in cool, dry places. Injectable drugs often need to be refrigerated to maintain potency. A new study from Belgium suggests that injectable drugs stored in ambulances may lose potency much more quickly than most health professionals realize. Researchers compared activity of an anti-seizure drug called lorazepam stored at room temperature in the refrigerator or in the back of an ambulance. The refrigerated drug lasted well for a year, but the lorazepam in the ambulance had lost substantial potency within 1 month. A muscle relaxant called succinylcholine also began to deteriorate after a month, even though the expiration date was much longer. The implication of this research is that temperature variations and light exposure may shorten the useful lifespan for certain medications. This may also raise a red flag for liquid medications shipped to patients by mail order. If they sit for hours in a hot mailbox, such formulations may lose potency faster than expected.
An FDA expert panel recommended loosening restrictions on a controversial diabetes drug called Avandia. Banned in Europe, this drug has been linked to an increased risk of heart attacks and strokes. In the U.S., the FDA has limited its use to people who can't tolerate other diabetes drugs. The agency may now make it easier for doctors to prescribe Avandia in the future.
Crash diets are popular this time of year as people try to get into shape for swimsuits. Restricting calories severely, however, has a serious downside. Swedish researchers collected data from more than 6,000 dieters. Roughly 50% were on a low-calorie diet of around 1,200 to 1,500 calories daily. The other half were getting just 500 calories a day for up to 10 weeks. Although the crash dieters lost more weight, they were also 3 times more likely to land in the hospital with a gallstone attack. This complication is painful as well as dangerous. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Today we're talking about ticks, fleas, and a mystery disease. Lyme disease has been recognized as a problem for decades. It's caused by an organism called Borrelia that's transmitted by the bite of a deer tick.
There's another germ that can also cause a lot of misery, but it's almost unknown. Bartonella is transmitted by fleas, ticks, and biting flies. It may be responsible for many illnesses that go undiagnosed.
We're talking with the world's leading expert on Bartonella. Dr. Ed Breitswert is a veterinarian and an infectious disease specialist at North Carolina State University College of Veterinary Medicine. He's an adjunct professor of medicine at Duke University Medical Center and is also the past chairman of the board of the American College of Veterinary Internal Medicine.
Welcome to the People's Pharmacy, Dr. Breitswert.
Thank you very much.
Dr. Breitswert, how did you get interested in Bartonella? What is it? Why is it? And why has it consumed so much of your professional life over the last decade or two?
Joe, historically, when I joined the faculty at North Carolina State University College of Veterinary Medicine, I made a decision as a relatively young associate professor that I wanted to emphasize research in vector-transmitted infectious diseases, and at that time it was tick-transmitted infectious diseases. So my lab first worked on Rocky Mountain spotted fever. We then worked on a genus of bacteria called Ehrlichias, which are very important animal pathogens. They're very important human pathogens, and were emphasized and literally discovered in animals decades before they were ever found to infect humans. We then kind of wandered into the world of Bartonella because of the historical association of one Bartonella species with the disease that most people are familiar with, and that's cat scratch disease. That association was made because a rickettsiologist at the Centers for Disease Control and Prevention, Russ Rignery, was looking at a newly isolated bacteria from an AIDS patient in Texas, and the fact that in AIDS patients, this particular bacteria would cause silver staining lesions with these bacteria being visible. And that is exactly what pathologists would see in the lymph node of a child or an adult with cat scratch disease. Rignery then went on to make the first isolate of Bartonella henselae from a cat, and ultimately showed that cats can be infected chronically in their blood with this bacteria. And when he presented that at the American Society of Rickettsiology meeting, that got us started on Bartonella research.
How long ago?
That would have been 1992.
Well, this gets us to rickettsia. So what are we talking about in terms of the germs, the bacteria, and the diseases that are involved?
So if we back up the rickettsia is just a little bit to a bigger group that's called the alpha proteobacteria. Then rickettsias, ehrlichias, anaplasmas, bartonellas, and a bunch more that I won't mention are in that overall group. They share a common heritage on an evolutionary basis, and that heritage has allowed them to adapt to being transmitted by a vector, many times a tick, flea, louse, and to persist in blood, at least of a reservoir-adapted animal host, for a very long period of time.
Dr. Breitschort, one of the unique aspects of a lot of these bacteria that you have been interested in for so many years is that they take up residence inside red blood cells, or inside cells, I should say, which makes it much harder to eradicate them with drugs and much harder to detect. So they're a little different from the normal kinds of infectious diseases that humans are prone to. Can you explain that just a little bit and why that might be responsible for this chronic disease state?
Within that large group that we mentioned, the alpha proteobacteria, some of these bacteria over time have lost genes to the extent that they cannot live outside of a cell. They are what microbiologists refer to as obligate intracellular bacteria, meaning they have to be in a tick cell, a flea cell, or an animal or human cell. So those organisms are extremely difficult to isolate, are not generally isolated in a routine diagnostic or commercial diagnostic setting, and are only isolated in research laboratories literally around the world. And when the Bartonellas came along, the good news about those organisms from a research standpoint and assigning a PhD graduate student to work on specific questions is they can live in cells, and yet they can also live outside of cells. So, for example, Joe, Bartonella henselae in flea feces is viable for up to 9 days. And having spent the early part of my career working on tick-transmitted disease, I do want to say that I am more worried about the worldwide impact of fleas in transmitting particularly Bartonella species to animals and humans throughout the world.
So how would someone be infected by Bartonella? How would a dog or a cat be infected? And what are the symptoms or implications of a Bartonella infection?
So the way a cat or a dog would become infected is fleas or ticks. Tick transmission of Bartonella has been a controversial area for the last 5 or 6 years. Unfortunately, 2 or 3 studies that have been published within the last year further support the fact that certain ticks in certain parts of the world are transmitting Bartonella species. The other source of infection, and has related to our research in as much as being a veterinarian, I'm concerned about my colleagues who develop chronic illnesses that to an extent seem unexplained. And when we went from doing cat Bartonella research to dog Bartonella research to some marine mammal research, ultimately we developed a new technique for identifying these bacteria, and we got Institutional Review Board approval to be able to test humans. And the initial humans that volunteered to be entered in our study were veterinarians, veterinary technicians, and veterinary spouses.
So are there Bartonella floating around in human beings?
Unfortunately, yes. And the risk factors are extensive exposure to ticks, fleas, lice, the biting flies.
Biting flies, which are in a lot of places, especially at the beach in the summer.
Absolutely. The wingless flies, which are commonly called keds, which are on sheep. So the risk factors are really complicated.
Dr. Breitschort, what are the symptoms of Bartonella infection? In other words, if we were to run down the list of complaints that veterinarians who have been infected either by cats or dogs would come to you with, what would be some of the most common symptoms they would be manifesting?
In regard to symptoms, probably, and you might chuckle at this, Joe, since you and I are starting to get a little gray hair, is memory loss. And fuzziness in thinking is one of the major and most frustrating complaints that these veterinarians report. And some of them are a lot younger than we are when they're experiencing this problem. The second problem that is most frequent is migrating muscle pain. And probably third in the list is joint pain or pain around the joint or over a bone, like particularly the shin bones.
So all three of these symptoms could easily be chalked up to getting older, as you say, the gray hair syndrome, memory loss, a little fuzziness, some muscle pain, and some arthritis. That comes with too many birthdays. But what you're saying is those are classic symptoms of a Bartonella infection. What are some of the other symptoms?
One of the most complex, frustrating, and difficult aspects of this bacteria is that it may cause an acute infection, but in most instances, that acute infection is going to be a flu-like diagnosis. And Bartonella is never going to be in the differential for the vast majority of people with a flu-like diagnosis. Bartonella can cause fever of unknown origin, and there's 3 reviews in which it's a very frequent cause of fever of unknown origin in children. But for most individuals, after the transmission of this organism and that mild flu-like illness, then there's a period of chronic bacteremia in which they show no symptoms at all, or their symptoms are good days and bad days. And there's not too many of us that don't have good days and bad days. So what happens after that is immunologically, physiologically, and medically unclear. But what is clear is that these people start to have a problem with having this bacteria circulating in their blood, and as we talked about earlier, invading cells.
You're listening to Dr. Ed Breitschwert. He's a veterinarian and an infectious disease specialist at North Carolina State University College of Veterinary Medicine. In addition, he's an adjunct professor of medicine at Duke University Medical Center. He's also the past chairman of the board of the American College of Veterinary Internal Medicine.
You know, it's so hard to detect something that you don't even know you should be looking for.
Well, exactly. If you're not looking for it, you're not likely to find it.
And if there's no easy test to find it, that makes it even more complicated.
That's exactly the situation that veterinarians and doctors have been in with Bartonella, but it's changing.
It's changing, and a lot of people may be infected and not even know it. We need to take a short break. When we come back, we'll learn more about how Bartonella infections are diagnosed and who's at risk.
We'll also learn about a doctor in Maryland who suspected that some of his arthritis patients might be suffering from undiagnosed Bartonella infections. He collaborated with Dr. Breitschwert on a study of these patients.
We'll find out about his fascinating findings and discuss the implications not only for his patients from Baltimore, but for people suffering from brain fog, joint pain, and inflammation. More about ticks, fleas, and a mystery disease after this break.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible by Red X Industries, makers of Utter Cream and Utterly Smooth Extra Care Cream, enriched with urea to moisturize dry, cracked skin. 800-345-7339. Online at uttercream.com.
And by We Patients, where you can learn from others about possible triggers and potential treatments for your headaches or migraines. Online at wepatients.com.
If you would like to order a CD of this show, you can call 800-732-2334. This is show number 907. That number again, 800-732-2334. Or you can always place the order at our website, peoplespharmacy.com.
The idea that ticks, fleas, lice, or biting flies could transmit a mysterious illness that can cause arthritis, brain fog, neuropathy, or fatigue is controversial. Bartonella can be very hard to diagnose, and few doctors have even heard about it.
Our guest today is Dr. Ed Breitschwert. He is a veterinarian and infectious disease expert at North Carolina State University College of Veterinary Medicine. He's also an adjunct professor of medicine at Duke University School of Medicine. Dr. Breitschwert, you've been describing the symptoms, the very nonspecific, extremely common symptoms that can signal a Bartonella infection. For example, muscle aches, joint pain, a little fuzziness in the brain, possibly some fatigue. How in the world is anyone going to make a diagnosis based on such common symptoms?
It's an excellent question and not an easy question to answer. But I think the place that the physician or the veterinarian would start is with the risk of exposure. So clearly a person that has a lot of animals, clearly a person who rescues a lot of animals that are covered in ticks, covered in fleas when they rescue them, individuals who groom a lot of animals, individuals who are out there in nature and enjoy nature or have a job occupationally where they're cutting down trees or surveying land and ending up with a lot of vector tick exposure in that way. I think what physicians and I think veterinarians, because so many of our patients come in with ticks and fleas on them, we tend to ignore the fact that, oh, gee, they just have a few ticks and fleas. On the other hand, I think for physicians, it's really establishing, is there a risk that this person could have been exposed to a Bartonella? That comes down to vectors in animals.
Well, this takes us to a study that you participated in amongst arthritis patients in practices in the Baltimore, Maryland area up to the D.C. area. And I think the results were really quite astonishing. Can you describe this study for us, please?
Certainly. I'd like to give the background that it's a Friday evening. I've been on clinics all week at the veterinary college here in North Carolina. I go to my office to answer emails and gather up some things, and my phone rings. I answer it, and there's a rheumatologist on the other end of the phone saying, I've read a couple of your recent reports on what you're finding in veterinarians, and I've looked at the symptoms that you're reporting, which are the symptoms that I see in my patients, and I'd like for you to test some of my patients. To be honest, Joe, my initial response was no. And it was no because anytime you start with a new infectious disease, no one is funding research to try to understand that new infectious agent, that new kid on the block. This particular rheumatologist hooked me by saying, I see a lot of patients with immune-mediated and autoimmune diseases, and I believe there's an infectious basis in some of my patients. And as a veterinary internist, I have believed that for 15 to 20 years. It's certainly not unique. There's plenty of other people out there that believe that. And the techniques are getting better to be able to prove that there are organisms that can persist in our bodies, in our blood, or in our tissues that ultimately lead to very chronic infections and very complex disease expression.
Tell us about the study.
So we did, after the conversation, I agreed to test a small number of this rheumatologist's patients, and I think it ended up being 296 in a one-year period. And as you alluded to, this study was amazing, and this rheumatologist is better at finding Bartonella-infected people than if I test what is perhaps the most high-risk population that's out there, and that's veterinarians and veterinary professionals that every day of their life are dealing with animals covered with ticks, covered with fleas, and experiencing bites and scratches. So in that study, picking people very specifically, these 296 out of his total patient population on the basis of high C-reactive protein, or what is referred to as small vessel disease, bacteremia was 41%.
So 2/5 of his patients had Bartonella.
Yes.
Now, you did find a 62% antibody rate.
Right.
Suggesting that almost 2/3 of these patients with arthritis may have been exposed to Bartonella.
Absolutely. And again, the exposure rate, the serologic rate that we got in the rheumatology group was higher than we got in the veterinary group. In the veterinary group, I think it was 40-some%, and in the rheumatology group, 60-some%.
Now, let's describe the symptoms that these patients with arthritis also had. Blurred vision, numbness, memory loss, balance problems, headaches, in some cases seizures. Sometimes they had difficulty with coordination, muscle pain, insomnia, severe fatigue, neurological problems, and arthritis. That was the key. That's what got them into the rheumatologist. These are all very ambiguous symptoms. These are symptoms that literally tens of millions of Americans are complaining about on a daily basis.
But they are also symptoms that are going to have a big effect on quality of life.
A lot of our listeners are saying, but wait a minute, I've got those symptoms. Could I have been bitten by a tick that had Bartonella? Could I be suffering from this condition? My doctor never even thought to ask me.
I think it comes down to education. It comes down to more research to put into perspective how important the observations to a great extent that have come out of my laboratory are real and applicable across the areas of risk that we believe exist right now. And for the last several years, using the term tipping point, I have hoped and literally prayed that we would reach the scientific tipping point with the genus Bartonella that would stimulate much more research on this organism and would stimulate funding agencies to preferentially put funds and say, this is an organism that needs to be considered.
What did the rheumatologist who you co-authored this study with do with all of those patients who turned out to be exposed to Bartonella and presumably had symptoms as a result of that infection? Did he treat any of those patients with antibiotics? And if so, did you ever find out what the outcome was?
So the answer to the question is this rheumatologist believes that this research collaboration has changed his life, changed his career, and changed his approach to his patients. And yes, he is using more antibiotics in his practice today than he ever has. And I say that with trepidation and the understanding that on the one side, we're worried about antimicrobial resistance and the development of superbugs, and on the other side, we're talking about organisms that may be smart enough to persist in our blood for long periods of time that a single antibiotic might not be effective to eliminate. So the number of questions, issues, and controversies that this little genus is going to generate, I think over time will be substantial. But he is treating with nutritional support, with vitamin support, with anything he can do to promote healthier immunologic response, and he is using antibiotics.
Dr. Ed Breitschwert, thank you so much for talking with us on the People's Pharmacy today.
Thank you for the invitation to be with you.
You've been listening to Dr. Ed Breitschwert. He's a veterinarian and an infectious disease specialist at North Carolina State University College of Veterinary Medicine. He's also the past chairman of the board of the American College of Veterinary Internal Medicine and chief scientific officer of Galaxy Diagnostics, a company that provides diagnostic tests for Bartonella.
We turn now to the physician who contacted Dr. Breitswert. Dr. Robert Mosieni is a rheumatologist with graduate and postgraduate physician scientist training from Albany Medical College, Yale University, Howard Hughes Medical Institute, and the National Institutes of Health. He's presently in private practice in Bethesda, Maryland, specializing in chronic inflammatory diseases that show up with rheumatic and neurovascular manifestations.
Welcome to the People's Pharmacy, Dr. Mosieni.
Thank you. My pleasure.
Now, we're very interested in the article that you published last year in collaboration with a number of scientists at North Carolina State University School of Veterinary Medicine. This article was published in Emerging Infectious Diseases, and you were the physician. Now, obviously, the folks at the vet school, most of their patients don't talk very much. But you had a group of human patients. Would you tell us about them, please?
Well, certainly. It's been quite the journey. Really amazing and wonderful things. And just in the course of that, just being a witness to a tremendous amount of human suffering and a potential answer for them. But that story has another thread in it, which is some experiences I had in learning to recognize the clinical pattern of what I would call small vessel disease. It turns out that the nervous system is very sensitive to disruptions of blood flow and vascular inflammation. And so it turns out that if you want to recognize small vessel disease early, you need to become a pretty good neurologist. And so, yes, while there may be, pain syndromes and other, because the nerves are lengthy and because over their course they're fed by many different small blood vessels, a disruption of flow or inflammation in the vessel can potentially disrupt the nerve anywhere along its course. And in the central nervous system, the blood vessels that feed the white matter areas of the brain don't have good collateral flow. And so any disruption of blood vessels in the central nervous system is manifest as what we call a subcortical neurological deficit. Some people would call it one feature of that would be executive dysfunction.
Okay, so I'm getting a little confused here. You're talking about blood vessel and vascular disease and how it might affect executive dysfunction. What does all of this have to do with tick bites?
Good question. So these infections are primarily infections of the vascular system. So, for example, when one gets an infection with Bartonella, which is one of the things you can get from a tick, but you can also get it from fleas and cats and potentially any biting insect. But when you get Bartonella, the Bartonella infects the blood components as well as the lining of the blood vessels. And so in the course of that happening, you compromise blood flow through small blood vessels, thereby having manifestations in many different tissues and organs of the body. An example of it would be that in the nervous system, you have these symptoms more manifest because the nervous system is the most sensitive system of sort of tripwires and sensors that let you know that something's wrong with the small blood vessels.
So you're going to have some nervous system symptoms. What sorts of symptoms have you seen?
Well, we discussed the central nervous system symptoms, but people also have peripheral neuropathy. In other words, they may have disruptions of sensory nerves or motor nerves, so they can have altered pain sensation, episodic sharp pains. They might have chronic pain syndromes, vibrating sensations on their body,
tingling,
numbness,
burning. So wherever you have nerves, they can be affected by these small blood vessels being inflamed and irritated.
Absolutely.
How do we get from the nervous system, the brain not working as well as it should, the nerves firing incorrectly and causing pain and dysfunction as well, to arthritis?
Well, when you have a chronic infection, and even an acute infection, how your body responds is more of a determinant of the disease that results than perhaps even the germ itself. So if a germ is highly pathogenic, an example being a flesh-eating strep or Ebola, the germ is really what determines the damage, and pretty much anyone who gets infected will have a similar, sort of response. In the case of these chronic infections, the body's response, the host response, has a very large role to play in determining what sort of disease is manifest. And so if you have the right immune genes that give you arthritis, you're going to get arthritis from the infection. If you have the right immune genes that stimulate a stronger inflammatory response in your blood vessels, you'll have more of a vascular immune response and therefore potentially of a neurological response as well.
Part of the problem, as I understand it, Dr. Moziani, is that Bartonella has not yet really reached the consciousness of many of your colleagues, physicians in general, rheumatologists in particular, but also with patients. So Bartonella is like, what are you talking about? We've heard of Rocky Mountain spotted fever. We've heard of Lyme disease. Bartonella? Cat scratch disease? That's weird. Just not on our radar scope.
That's correct. And in fact, if you read the typical medical textbook, it'll tell you that cat scratch disease, which is one manifestation of Bartonella, is a benign self-limiting disease of no more than a few weeks duration, which may or may not require up to 2 weeks of azithromycin or some other antibiotic. So the conventional wisdom and the teaching in medicine is virtually non-existent in physicians who treat human patients.
Dr. Moziani, do veterinarians know more about Bartonella and the way it infects mammals than physicians who treat human beings?
Absolutely. There's no question. For example, it's well known by veterinarians that fleas transmit Bartonella, and so they understand it at the very least in the teaching of cat scratch disease. It's uncommon for a human to have experienced it, but veterinarians see that all the time with the pets they take care of and their owners.
You're listening to Dr. Robert Moziani, a physician in Bethesda, Maryland, specializing in chronic inflammatory diseases with rheumatic and neurovascular manifestations. He's Chief Medical Officer of Galaxy Diagnostics.
This idea that small blood vessels can affect the brain and cause brain fog or cognitive dysfunction is kind of a new idea, and not on most people's radar scopes, but it is fascinating. We do need to take a short break. When we come back, we'll find out more about Dr. Moziani's patients. What were their symptoms? Why did he decide to test them for a relatively unknown infection called Bartonella?
What's the best way to treat Bartonella infections? And how long does it take?
Is there hope for patients suffering from the long-term complications of this mysterious epidemic?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like the information you hear when you listen to The People's Pharmacy, you may also enjoy our book published by National Geographic. It's The People's Pharmacy Quick and Handy Home Remedies, available online at peoplespharmacy.com or at your favorite bookstore.
Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel soft and smooth. The number's 800-345-7339. Online at uttercream.com.
And by We Patients, where you can learn from others about possible triggers and potential treatments for your headaches or migraines. Online at wepatients.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 907. That phone number again, 800-732-2334. Online at peoplespharmacy.com.
Today we're talking about a little recognized infectious agent that causes untold misery. Bartonella can be transmitted by ticks, fleas, lice, or biting flies. It's a different pathogen from Borrelia, the organism that causes Lyme disease, but it may be equally devastating when left untreated. Our guest is Dr. Robert Mozzaieni, a physician in Bethesda, Maryland, specializing in chronic inflammatory diseases with rheumatic and neurovascular manifestations. His study, done in collaboration with Dr. Breitschwert, was published in Emerging Infectious Diseases. You'll find a link to it from our website.
Dr. Mozzaieni, so you had a bunch of patients. How many?
In that study, 296.
And these are patients who were suffering from what kinds of symptoms?
These patients had a variety of symptoms, and so for one reason or another, they had concerns that they might have Lyme disease.
Give us some sense of what they complained about when they walked into your office, kind of typical patient.
They might have had various neurological symptoms, numbness, tingling, trouble with cognition, brain fog is what they would describe it as, a wide variety of symptoms. And in their quest for looking for an answer, they had a variety of tests usually done before they came in. And what was often found in them was some sort of positive result for borreliosis or Lyme disease.
Now, I assume they ended up in your office in part because many of them also had some joint conditions.
Right. Many of them had other conditions. So not all those patients in there had come in complaining of or being concerned about Lyme disease. So it was a broader set than just Lyme patients.
What inspired you to get them into this study to test for Bartonella, and what were the results?
The inspiration came from the fact that I had, due to some other work I had done in the past, begun to understand the clinical manifestations of small vessel disease, and particularly manifestations that are neurological. And so based on first looking at those patients who had more predominant neurological or neuropsychiatric symptoms, I asked them to enroll in the study wherein we tested their blood for Bartonella. And what we began to find after a short period of time, in fact, I remember specifically Dr. Breitschwert calling me one day and saying, hey, we're finding that in the patient specimens you're sending, there's a higher prevalence of Bartonella than we've seen in any other high-risk group, including veterinarians who are regularly exposed.
Did that surprise you?
Very much. We were all very surprised. I had some inkling that it was an issue. I suspected that because Bartonella was more principally an infection of the vascular system, that it could explain a lot of the neurovascular symptoms my patients had. And so I had an inkling, but I really wasn't prepared to learn or hear that there was such a high prevalence. In fact, the prevalence of it was so strongly affirmed by the type of testing we did that relative to the other testing, say for Borrelia or anything else, it was a much more certain result and a correlation with their symptoms than anything else we had tested for. So
here you have a bunch of patients who are complaining about brain fog, neurological conditions, maybe there's some tingling and pain in their extremities, and some of their joints are really hurting. And now you've said, wow, this may be not a rheumatic disease, but actually an infectious disease. It may have been brought on by a bug, so to speak, and in this case, maybe it was Bartonella. What did you do next?
Well, these patients are among the most challenging any internist would ever take on. So one has to look 360 degrees at every possible explanation. So after meticulously going through each of their cases one by one to see what else could be a driver of their illness, and unfortunately there are always comorbidities. Patients aren't like a controlled clinical trial. There's always something else. And so after systematically going through the easier and more obvious options, we were left with a set of symptoms that, we had no other way to explain. And we had other infectious disease data, such as for Lyme disease, but the evidence that was coming out for the Bartonella was much stronger and more clear and more certain. And so I began to suspect that was the cause of their symptom. Now, in medicine, when you've discovered something new and you're not really sure if it's the cause, you really can't assume that, and you can't tell the patient that it is, but you then watch those symptoms that the patient had as you start treatment to see if those symptoms begin to resolve. and more importantly, if they do so consistently across the patient group that you take care of. And so as we started them on antibiotic therapies, I began to see a very clear and regular kind of response that they all had. Even the kinetics of the response, the time frame of the response, the type of response was very similar across the patients. And so from the time frame of the start of the second antibiotic, about 6 weeks to 8 weeks after that is when the patients start accelerating in their neurological improvement and their energy and their cognition, and they start developing lots of joint pain. And
so the joint pain gets worse.
It does. And even if they didn't have joint pain, they develop it.
So it takes quite a long time.
Yes.
Even considering that, once you start treatment, it sounds as though that's maybe, as you said, it might be 6 months later that the patient actually feels well.
The antibiotics, the antibiotic regimen is a double regimen, which I run for 6 months after it reaches the full dose. So typically it will take 2 to 3 months for us to maximize the dose, and then I'll run it for a full 6 months. And the goal of therapy, the endpoint of therapy, is to have a patient who's been well for a few months. So these are stealth germs. They're slow growing. They have slow replication times. And the treatment protocols for this are beginning to look like the long-term treatment is really necessary. That's further validated by the fact that we've had at least 6 or more patients who had persistent, detectable, growing Bartonella even after more than 6 months of antibiotic therapy.
This runs in the face of what most of your colleagues are familiar with, which is, you've got pneumonia, 2 weeks, and we've got you cured. You walked out the door and you're fine. All you need is your amoxicillin or your erythromycin. What you're saying is that this is a long-term adventure, 6, 8 months, maybe as long as a year. I bet a lot of your colleagues are sort of scratching their head going, what's he talking about? How come it takes so long?
Well, Bartonella is unlike any other organism we know. Many of those other ones that are given as examples are very susceptible to antibiotics. The antibiotic world is divided into bactericidal and bacteriostatic antibiotics. All the antibiotics that we find useful for this are bacteriostatic. They don't kill the germ outright. They just suppress its growth. And the only one that's bactericidal is a dangerous intravenous antibiotic, which we really don't want to use. And so we really don't have the best possible choices for treating this. And furthermore, the germ is highly adaptable. For example, if a patient is given antibiotics for a misdiagnosis of Lyme disease, they will cause the Bartonella to dive into and hide from the antibiotic inside of cells.
So in other words, if someone is misdiagnosed, treating them actually with standard therapy for Lyme might be counterproductive.
Correct. And it might even explain why there's so many treatment failures in Lyme.
It's my understanding that Bartonella can live in red blood cells. Is that true?
Yes. It likes to live in, usually on, but sometimes I think if certain antibiotics are used, the Bartonella would prefer to be inside the red cell. And so they can move in and out of red cells.
And when they're in, they're kind of hiding. They're kind of hard to get to and hard to treat.
Yeah, it'll depend on how well an antibiotic can penetrate the cell.
Mm-hmm.
So we tend to pick things that are well absorbed and which can also penetrate cells.
Tell us about some of your success stories, some of the patients who came to you in pretty bad shape, cognitively as well as rheumatically, so to speak, people with real severe arthritis pains. Have you actually been able to, quote-unquote, cure patients who had otherwise felt that they had a chronic condition that wasn't going to go away?
Sure. We are all very careful about how we use the word cure, but most of the patients do very well. Most of them recover. It takes a certain kind of patient to go through a long-term treatment process. And as an example, there have been some who have been defined by other rheumatologists as having rheumatoid arthritis. And not all of them have Bartonella, but a fair number of them might. And what I have observed that if we use the Bartonella antibiotic regimens often, we have a very good result in patients diagnosed as having rheumatoid arthritis if the treatment is started early enough. Now, rheumatoid arthritis is very complicated. It has an autoimmune component, presumably, but I think that a lot of these conditions, if you start the treatment early enough, the immune system will calm down enough that the disease can resolve. So I've seen many patients with rheumatoid factors that were elevated that resolved to normal, and their symptoms, which are classically clinically defined as rheumatoid arthritis, also resolved. And so my own clinical experience has been at around a case number of about 20 or so, but this now needs to be moved into a more formal observational study and then ultimately a randomized controlled trial. And so there's a lot more legwork to be done, and we need to be careful not to treat every arthritic patient with antibiotics. But there is more literature. Usually, for now, it's on the safety side of the field of rheumatology and other fields, where there are examples or case reports of patients who had undiagnosed Bartonella before they received immune suppression. And so I think that the traction for the awareness of Bartonella in human medicine is going to first come through the angle of safety. In cases where we use immune suppression, in cases of bone marrow transplantation, organ transplantation, and certainly in rheumatology where we use a lot of immune suppressing drugs, I think it's going to become more important to understand these fastidious, hard to detect germs, because they can become a real problem if we immune suppress.
I'd like to go back to that idea that these germs are hard to detect, because in fact it's not easy to find a Bartonella infection, is it?
No, it's quite difficult. Sometimes you get lucky with the test, but to give you an idea, when we currently do a blood culture, first of all, we do a series. Now, traditional blood culturing is 2 specimens. We do 3. If you do 3 over a course of several days, because on any given day, even in an infected patient, the level of Bartonella may be undetectable in their blood. Cats who have a millionfold higher levels of Bartonella when they do get it, even they have a few days of the month when you will not be able to detect Bartonella in their blood. And so it's a multi-specimen culturing process because it's vulnerable to sampling error. You may miss something. I tell people it's like going fishing. If you don't catch something, it doesn't mean there wasn't a fish in the lake. And so every specimen we get at Galaxy Diagnostics where it's tested is then tested by PCR, which is a way to detect DNA. It's tested on blood and serum and then cultured in a special enrichment medium that helps the Bartonella grow, because if the levels are too low to begin with, if we let it grow, it can then reach a detectable limit, which can then allow us to detect the DNA. And so each of the 3 specimens is processed in that fashion. And so with that, we think we have about a 90% chance of being able to capture or diagnose the Bartonella.
These aren't standard tests. These aren't the kind of tests that the average walking around internist could send off to the local laboratory and be analyzed and get a result in 3 days.
No, they're not. These are new emerging tests, and the awareness of this infection is emerging in human medicine. If you look at the history of infectious disease, for example, just by taking a walk through an old cemetery. So, for example, in Philadelphia, where Ben Franklin is buried, you'll find that most of the people buried there were children. And so these very severe, more deadly germs, which we now think of as really just routine, like strep, for example, or viruses like measles, we can now treat. So the history of human longevity is mainly a story about learning to diagnose and treat infections. Now, the easy, ready-to-detect infections were among the first that we found. Obviously, the obvious ones were obvious. So now we're dealing with the more subtle ones. So the tools that we use to detect those are now have to be more subtle. So we've got to do multiple specimens. We've got to culture it for a long period of time. This is a germ that's stealthy. It has a slow doubling time, and so it's even hard to grow once you can grow it. It doesn't grow in typical mediums. It doesn't grow well in agar plates. You have to develop a special medium, and that's really the key innovation of NC State's Vector-Borne Diseases Reference Lab that Dr. Breitschwert has run for years. It's that key innovation that has allowed this germ to be cultured more readily and thereby detected.
My suspicion is that there are patients who come to you and after they're diagnosed and treated successfully, and maybe even before they've been completely treated successfully, say, oh, Dr. Mosiani, thank goodness. Now I know I'm not crazy. Now I know that I haven't been making this up the way some people have suggested.
Absolutely. I mean, if you ask the patients and let them think back to their first appointment, which none of them seem to forget, they may forget everything else, but they seem to not forget that. What they all remember is that in the course of trying to explain their symptoms and put the whole picture together, they get validation. And most of them start crying when you first start explaining that to them. And so they get validation. They know they're not crazy, and there is a process. It's complicated, but the steps can be outlined as to how one event leads to another, which leads them to where they are. So I think it may be hard for them to find ways of getting treated, but sooner or later I think they do. And the good news is I don't think that, at least over the course of a few years, it doesn't seem to cause permanent damage. We still don't know what the outcomes are going to be and how well we're going to be able to completely eradicate it, but I think it's possible to go back to relatively normal existence.
Dr. Mosiani, thank you very much for talking with us on the People's Pharmacy today.
My pleasure. Thank you.
You've been listening to Dr. Robert Mosiani, a rheumatologist in private practice in Bethesda, Maryland, specializing in chronic inflammatory diseases that show up with rheumatic and neurovascular manifestations.
We spoke earlier with Dr. Ed Breitschwert, a veterinarian and infectious disease specialist at North Carolina State University College of Veterinary Medicine. He's also an adjunct professor of medicine at Duke University Medical Center and past chairman of the board of the American College of Veterinary Internal Medicine.
Lynn Siegel produced today's show. Russ Henry and Al Wodarski engineer the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Red X Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number is 800-345-7339. Online at uttercream.com.
To order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 907. That number again, 800-732-2334, or on the website peoplespharmacy.com. You'll find an extended bonus interview with both of our guests, along with a link to their article in Emerging Infectious Diseases. That's on our website.
And when you go to our website, you can let us know what you think about today's show. Share your own story. Check out our books and informational guides. At peoplespharmacy.com, you can find answers to your questions about common ailments, prescription medications, herbs, and home remedies.
You can also sign up for our free online newsletter or the free podcast of the show. You can share it with a friend. It's all there at peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.